bringing us that update coming in from Lucknow. Viewers, massive protests there as illegal chambers have been targeted by the municipal corporation now. And we now move on. Today is the World Hypertension Day. High blood pressure is often called the silent killer. It's silent because most people do not experience symptoms until severe complications are seen. Yet it is deadly because uncontrolled hypertension significantly increases the risk of heart disease, stroke, kidney failure, and premature death. The World Health Organization has shared a tweet on social media stating, as you reach for the salt, remember most of the salt we consume is hidden in processed and packaged foods we eat. We don't just notice it. Choose fresh, healthier foods, read label, and pick low salt options. Use and cook with less salt. Use herbs and spices to flavor food instead of using these processed foods. Now remember, these simple choices can go a long way in protecting your heart health. Let's also open this up for discussion with Dr. Kushal Banerjee and Dr. Gagandeep Singh, who are joining us. Doctors, thank you very much for joining us. It's World Hypertension Day. First of all, take us through how common hypertension is and how many lives are claimed due to it.
So, I'm jumping in. Hypertension is actually a worldwide epidemic, a pandemic of sorts, it can be said. As you've just pointed out, the WHO's warnings about hypertension, it is highly prevalent in India alone. Amongst the adult population, it's estimated that the incidence could be anywhere between 25 to 34%. Particularly concentrated in the northern states and the eastern parts of the country, slightly lower prevalence in the southern states. So this actually translates to almost 25 to 27 crore Indians suffering from hypertension. And that is a huge number. And unfortunately, it has also been noted that about 1/3 of the people who have been diagnosed with hypertension are not able to keep it under control because of certain factors, non-compliance with medication, etc. So this is a huge disease burden for India, and we have become, unfortunately, the hypertension capital of the world.
Right, Dr. Gagan, yes, please go on.
Yeah.
Please go on, Dr. Gagandeep. All right, what I also want to ask you is,
disease.
Yes, Dr. Gagandeep, I believe there's some lag there, but if you can hear me now,
Okay.
talk to us
Yeah,
about
I can hear you now.
Yes, okay. What is it that the common people should really do, adopt lifestyle choices? How can they alter their eating habits to reduce the precedence of such hypertension cases?
Right. So let's talk about the lifestyle factors that greatly increase your risk of having these diseases. So number one is intake of processed food. So a large intake of the average Indian, urban Indians diets and nowadays rural Indians as well is ultra refined processed food, which is super high in carbs, low in proteins. In fact, the recent ICMR study, which was done, said that almost 60% of Indians are eating too much carbs, too little protein, and too much of processed food. Also, the lifestyle has become predominantly sedentary, especially in urban areas. There's literally zero physical activity. And even if the physical activity is there, it is very low intensity. People consider walking as, a form of very big exercise. There's no focus on resistance training, building muscle mass. So most adults are living with what we call sarcopenia, low muscle mass. And apart from that, sleep is also a big issue. People don't have consistent sleep schedules, sleep disturbances. That is going to spike up cortisol. That is going to raise blood pressure. So the modern stress-filled urban lifestyle is making it a hypertensive environment for the entire country and also for the world. We need to change that.
Right. Finally, Dr. Kushal, I want to ask you what age group is most susceptible to hypertension, and when should people actually start focusing more on prevention of hypertension?
Traditionally speaking, back when we were in college, we were told that you should consider this as a diagnosis in 50 plus age group. And an important underlooked subgroup of the population is women. Women are often not even checked for hypertension, and we are discovering a high incidence of stroke, etc. So that's very important to put out. So 50 plus used to be a good ballpark to start thinking about hypertension, but that's no longer the case. Unfortunately, we are seeing an increasing incidence of lower age group, just young adults, people fresh out of their college, early in their jobs. So anywhere from the mid-20s onwards, one should start keeping an eye. Let's say not a paranoid level of fear, should not be encouraged, but yes, say in the mid-20s onwards, BP monitoring is a good idea, especially if you have family history, especially if you see that you are overweight, if your blood sugar, cholesterol, etc. is edging upwards, then blood pressure monitoring should also be part of it. I will also caution against overdiagnosis. A single elevated blood pressure reading, sometimes people just want to be on medicine all the time. That's not also advisable. We have this weird dichotomy in the urban, well-educated urban population in this country where there is excessive testing and every minute variation is diagnosed as hypertension. So there needs to be some caution there. But yes, mid-20s onwards is a good age group to start at least the process of monitoring, and then customize it according to your individual risk factors.
All right, Dr. Kushal and Dr. Gagandeep Singh, thank you very much for joining us on this very important discussion on World Hypertension Day. And with that, viewers, we're taking a very quick break. Stay tuned to NewsX.
अरे नहीं चाहिए टर्म